Willie Brooks and Hodari Brown, welcome. So Willie, I'm going to start with you, whether you're somebody who is close to someone who's sick or has died because of this, or just living in an environment where that is what's going on around you all the time, and you're enduring all the changes that have happened in our lives since this started. I think it touches everyone in a really profound way.
Other individuals in other parts of the world are already accommodated to wearing masks, social distancing, whereas with our culture, especially in America and in the Black community, it is a completely new culture change of being isolated, having to wear a mask, understand the importance of wearing gloves. That is why you can see the impact in Michigan, especially in Wayne County, are so drastic because of that culture change and so many other dynamics that are out there.
Hodari, you're a military veteran and somebody who has dealt with anxiety and depression brought on by stress and trauma. Tell us about your experience, and then tell us how you're experiencing what's going on now.
My experience comes from combat, but also the transition of coming back home and trying to just de-escalate from the military environment back to what we call the regular civilian life. But now with the coronavirus, one of the things I've noticed myself, even before it hit the height here in America, was like, people going to the store and just buying everything off the shelves like it's the end of the world, really put me in a fight or flight mode. And even right now, one of the things that I've had the difficult really just trying to deal with is really just to keep appointments. So instead of having that face-to-face appointment with my mental health counselors, we've had to go through Zoom calls or telephone conference calls. But it's still, as you mentioned, it's still tough because in the African-American community, we're used to those face-to-face interactions because that really helps in the process of really dealing with depression and anxiety as well as grief overall.
Willie Brooks, talk about the role that your agency is playing with people like Hodari Brown right now, the kinds of things that you're having to make available.
Anyone can get on our website, dwihn.org, and receive information on how to cope. And there's a couple of things that people should understand. This is going to change the way we interact for at least 12 months to probably 24 months. Mm-hmm. The fact that it's so unpredictable and that it can hit any age range, any person, it brings on a sense of terror. So you have to try to correct that with having a lot of facts and reality in your life. It is not helpful to look at COVID-19 from the time you wake up to the time you go to sleep and just looking at the numbers.
Hodari Brown, I want you to talk about what you would say to someone who's really experiencing anxiety or depression as a result of trauma, the way you do. What would your advice be?
My advice to someone who's experiencing trauma, depression, anxiety, or even overall grief right now is to really seek out help. The Detroit Wayne County Integrated Health Authority is one thing. You also can reach out to an organization I work with called NAMI, the National Alliance of Mental Illness. And then even reach out to your own personal care provider and see what resources they might have for you. Really, and then talk to your friends and family. Reach out to them on a regular basis. Don't go through it by yourself, because everybody right now in this pandemic is really going through a little bit of grief, anxiety, or depression at some point or another.
Yeah. It's okay to say you need help. That's great advice.